Okay, we'll make a start, I think. I think people are still joining. Good afternoon, everybody. My name's Gail Gibbons. I'm Head of Change at the YEF for Children's Services and Health. I'm joined by a number of my colleagues, including Violetta Tattoo, who's here sort of managing the scenes behind as we speak. And I'm really delighted that you've been able to join us today. There's been a fantastic response to this virtual learning cafe on family group conferencing. We have three excellent speakers who I know are going to be really, really engaging. We're going to run each of their presentations one after the other, and we're not going to pause for questions in between. And we're leaving a long time at the end for Q&A for any questions that you have for any of the three speakers. If you want to drop your question in the chat as you think of it, please do so because you might forget by the time we get to the end. The other thing I need to let you know is that we will be recording this session. Everybody who attends today will be sent out the link to get hold of the recording if you want it to either keep for yourselves or share with colleagues. And it will also be uploaded onto our website at the Youth Endowment Fund. Lastly, I just need to ask everybody, I can't see that anybody isn't doing this at the moment, but to keep muted unless you're speaking so that we don't pick up any unnecessary noise in the background, etc. So if you can put yourselves on mute, that would be fantastic. So first of all, well, I'll just run through who we've got today, but Cathy's starting. So today we have Cathy Ashley, Chief Exec at the Family Rights Group, who's going to talk to us about the family group conferencing model, some examples of good practice, and also how Family Rights Group supports family group conferencing in the UK. We're then going to move on to Jo Flanagan, who is the Senior Local Development Advisor at the Foundations, which is the What Works Centre for Children and Families. I've done it the wrong way around, haven't I? I've just saying that we're going to move on to Sophie Wood, who's from the University of Cardiff. She is a research associate and she has led on a UK-wide survey of family group conferencing provision. So she's going to talk us through that. And then we're moving to Jo, who's Senior Local Development Advisor at Foundations, which is the What Works Centre for Children and Families. And Jo is going to talk about an impact study that Foundations funded and has recently been published on family group conferencing and talking about some of the findings from that study. So without further ado, we're going to start with Cathy. Cathy, do you want to start your presentation? And as I said, do please drop questions in the chat and we'll pick all of them up as we go along. Over to you, Cathy.
Hi, thank you very much for inviting me to speak. And I'm now going to hope that it all goes beautifully when I look at sharing. Excellent. So let me just see, because it's coming up a little bit oddly in terms of on my screen. I don't know whether it's coming up oddly on yours or whether you've got a full.
It looks good to us, Cathy.
Okay,
it's the full screen and it's all
beautiful. And can I just say, it's very nice to see people on the screen, because often when you're speaking and you can only, you can't see real faces, and that always feels a bit strange. So really appreciate those of you who've got your camera on in order to be able to see you. Family Rights Group, of which I will be the chief exec for 20 years coming up in April, is a charity that works to ensure that the child welfare and family justice system support children to live safely within their family while strengthening the family and community networks of those children who can't live at home. And we do that through a range of different ways. We have a free specialist advice service for families, that's both parents and wider family kinship carers. So if you're working with families who are involved with children's services and need independent advice, to direct them to our advice service. and I'll put the details in the chat. We support local authorities through resources, training, consultancy, and as part of that, we are always innovating, trying to find family-led ways to improve our child welfare system. And obviously, family group conferences are a critical element of that. So in the early 1990s, we brought over some social workers from New Zealand, where family group conferencing had, as you may be aware, originated. It was a response to the large number of Maori children that were being taken into state institutional care, and it became part of the legislation in New Zealand. And we helped pilot family group conferences. The first was in Wales, and you'll hear later about the extent that family group conferences are now operating in England, Scotland, Wales, and Northern Ireland. We have a parents panel and a kinship care panel that is integral to all our work, and we're about to set up a care experience young people's panel. And then we influence, we lobby, we undertake research to change law, policy and practice. And examples of those include recent changes to legal aid in private law for special guardians and in adoption for birth parents. We got the exemption for kinship children from the two-child tax credit limitation. We were instrumental in family and friends care guidance, which I'll talk about later, and is relevant to this. And we got some changes to the COVID regulations, for example, in relation to children being able to see prospective kinship carers during the pandemic. So that's just some examples. So I'm going to take you then on to family group conferencing. Now, what I really want to do is distinguish between the term family group decision making and family group conferences, because I keep seeing in different places family group decision making, and I think there's a real danger that that terminology can mean all things to all people. So local authorities are saying, oh, we've had a family meeting and it was family group decision making, and you find that actually it was maybe a meeting between the social worker and the mother, maybe maternal grandmother was present. We've done a lot of research around the lack of engagement, routine engagement often of fathers and paternal relatives. I would make an exception that in Scotland, family group decision making generally does mean family group conferencing. But in England, that isn't by any means necessarily the case. And so what I'm going to talk about is family group conferences. Family group conferences are now, there's over 20 countries offering family group conferences. I've trained in FGCs in Sri Lanka, in Poland. Colleagues have trained in Germany and Italy, and a number of other examples around the world. And there is a European family group conference network. Critically, and I'll go into more details in a minute, but the critical part is it's a family-led decision-making approach. And the coordinator is independent of any decisions, as their manager, of any decisions being made in relation to that child. There is preparation, so it's not just about, and I think sometimes FGCs are referred to as if it's just the meeting itself. It isn't. It's critically involves preparation with the coordinator going out and meeting all those who are important in making a plan for that child. And I'll talk more about the process, as I say, in a second. So this is a rather snazzy diagram, I find, of our family group conference 7 standards. And these standards, which were drawn up between Family Rights Group and the Family Group Conference National Network, that we host, which is made up of local family group conference services, and of course with input from families themselves, underpin an accreditation framework that we also run at Family Rights Group. So we will accredit FGC services, local services, but these are the underpinning standards. So as I said, critically important that the coordinator is independent. Secondly, FGCs are a voluntary approach from the perspective of the family. They do not have to consent to an FGC. So if you hear anything which involves the family have to have an FGC, absolutely not. Now, obviously, we want families to be able to make informed decisions. And sometimes if a family is already at the pre-proceedings stage, it may be the decision not to have an FGC may itself have consequences about what the local authority then may do next. But the important point is that it is a voluntary arrangement, and that, or a voluntary decision, and that means that you need the consent of those with parental responsibility in order to progress. Then it's, as I said, it's family led. I'll talk a little bit more about referrals in a moment. The preparation needs to include ensuring that families understand and know what it is, both are the local authorities' concerns that the plan needs to address, but also what resources may be available from the local authority and partner agencies, as well as the family. There should always be, in the conference itself, private family time. And it should, and I hope this is sort of underpins all the work, but it should be working with the principles of equality and inclusivity. And I'll just mention that there should be an attempt to try and match the coordinator with the family's culture and individual identity, however that may be expressed by the family. So the process itself involves, you've got the referral, and it mentions here this could be from a social worker, health visitor, or teacher. In some, although it's only a small number of authorities that offer this, but in some it may be a self-referral from the family themselves. The family group conference coordinator is appointed. As I say, critically, they are independent. The preparation stage is absolutely vital. Young people should be involved in their family group conference, and children should be involved and in any way that they wish, and they should be offered an advocate. Again, who that person may be should be down to the child or young person. And then the conference itself, you have the information sharing time, you have the private family time where the social worker and other agencies shouldn't be in the room at that point. It is a family plan that's being made. The coordinator then comes back in the room, agrees with the family, the plan and the social worker, just testing whether, if there's questions, whether things need to be clarified. And the point is that the local authority should agree the plan as long as they feel it's safe. And then, and this is important also, that the plan, there should be a reviewing stage. So the family should be offered a review FGC. I've just come out of a meeting with some members of our parents and kinship care panel who've had an FGC, and only one had been offered a review FGC. That's concerning. It should be an important part of the process. And most importantly, I would say that plan then needs to be embedded in how the local authority works and supports that family, so that it doesn't end up with a situation where the family have made the plan. And again, it was raised earlier, the family came up with a plan that the local authority had said was safe, and then they disregarded it and went off and did their own thing anyway. So really important how that plan is then embedded in the way that the local authority works with the family and the child. Many of you will have experiences of FGCs. Principally, some of you will have had experience of family group conferences, maybe at the pre-proceeding stage, or maybe at the formal pre-proceeding stage, so when the local authority is considering taking care proceedings, maybe at the child protection point. Some of you may have seen FGCs, have been involved in FGCs in early help and child in need. Principally, it's when is a plan needed where the family needs to get together. And whenever we talk about family, we're talking not just about blood relatives, but also those who care about the child. That could be neighbours, it could be, you know, schoolmates' parents. It's whatever that family's network is. I wanted to mention about contextual safeguarding. On our website, there is a briefing that sets out how FGCs can be used in the context of contextual safeguarding in order to address risk to children and young people. I won't go into it in more detail now, but it is on the website. Community conferencing is often used to address maybe wider, maybe it's antisocial behaviour concerns, or where groups of young people are involved, maybe in a state in creating what some see as problematic behaviour. What I would say there is that some really interesting examples of community conferencing from across the world, including things like having an FGC for the individual child and then with multiple families, or doing it in different stages. So there's lots of different ways that FGCs can be adapted, sticking to the principles which actually reflect both addressing community concerns, including in relation to the youth justice arena, and also addressing the individual child's welfare needs and the family's welfare needs. In adult social care, it's sometimes used in relation to planning for someone coming out of hospital, or it's also in the prison estate, could be used in relation to planning rehabilitation of someone who's offended. Just very quickly about lifelong links, in case you've not heard of it, because it's a great passion of ours. Family Rights Group developed lifelong links, drawing on the FGC model, and lifelong links is about building a support network with and for children in care and care leavers. And it's now we were working with about 42 local authorities who are offering lifelong links to children and people in care. The evaluations have shown that it leads to a reduction in children's mental ill health, their well-being, creates greater placement stability, reduces the risk of homelessness, etc. Critically, it's about finding all who are important to that child or young person. And that could be, as I say, blood relatives, it could be siblings, it could be a former foster carer, a former teacher, bringing them together in a celebratory way to build that support network, because we all need people to turn to in life, emotionally, practically, and that's what Lifelong Links is designed to do. So just touching on, as organisations, charity, what we did, I mentioned we introduced FGCs. We run the Family Group Conference Network. If you're interested in joining, please get in touch. We run meetings on a regular basis with FGC managers for them to sort of explore some of the challenges they're facing and problem solve. We run similarly with Lifelong Links service managers. We run practice learning sets with Lifelong Links coordinators. We help local authorities to establish FGC services, run FGC training, and much more. I could go on. and we lobby and campaign, and critically, we've got the Family Group Conference Toolkit, we've got the Live on Links Toolkit, but the critical part is ensuring that the principles and standards of family group conferences are consistently implemented. Very quickly in terms of research, because Jo's going to talk about the research study that she was involved with, but I've just thrown up here some of the key findings from different research studies that have taken place about the impact of FGCs. And you can read those for yourself, and I'm very happy to talk through any further about what the research tells us in relation to the impact of family group conferences. This is the large-scale evaluation that Jo will be talking to you about, so I won't take up time now, but you can see some of the key points in that slide. And then here is some reflections from Ofsted about in their inspections in relation to FGCs. One thing I haven't mentioned that I did want to highlight though, and that is that family group conferences, and particularly family group decision making, is mentioned in Working Together, in the new version of Working Together. It's in the kinship strategy. Importantly, though, I want to take you to two pieces of statutory guidance. So statutory guidance applying in England and should be followed except in exceptional circumstances. Firstly, Family and Friends Care statutory guidance, which highlights the importance of family group conferences being offered to families. And secondly, statutory guidance, court order and pre-proceedings. And I would take you to page 24, which highlights that enabling wider family members to contribute to decision making where there are child protection or welfare concerns, including where a child cannot remain safely with birth parents, is an important part of pre-proceedings planning. Local authorities should consider referring the family to a family group conference service if they believe there is a possibility the child may not be able to remain with their parents, or in any event before a child becomes looked after, unless there would be a risk to the child. So I just want to really emphasise that this is the referral to family group conferences is actually set out in our legal framework, albeit that we know it doesn't consistently always happen. So that's the last point I'm going to raise now, and then I'll hand you back to Gail.
Brilliant, thank you, Cathy. And you managed to fit so much into 20 minutes. There's so much there. There's been a few questions and comments in the chat as you've been speaking. But as I said at the beginning, we'll leave those till the end. We won't forget them. We will come back to them, and then Cathy will be able to answer those later. But in the meantime, Cathy, if you can stop sharing your slides.
Now, I'm just working out how to do that now in my technically incompetent manner.
No worries. There should be, if you can't find it, there should be at the top on the top tab. There should be something that says "Stop sharing." Have you got it? Yeah.
Perfect.
Brilliant. So in that case, we shall now move over to Sophie for the next presentation.
Thank you.
Come in and share your slides.
Yeah. Here we go. Can you see those? Brilliant.
Yeah, we can, thanks.
Okay, great. So I'll get started. So hi, everybody. My name is Sophie Wood, and I am a research associate in Cascade at Cardiff University. And I'm also the study manager for the Family Voice projects, which is what I'm here to talk to you about today. So that's an evaluation of the quality and effectiveness of family group conferencing. So I'll just give a bit of background as to why we're doing this study. Research shows that family group conferences are well received by families, but comparative outcome studies have mixed results. There could be many reasons for this. Perhaps FGCs vary in quality, which then affected the outcomes in the studies. But outcomes also might depend on context. For instance, when an FGC is offered, for instance, if it's offered at early help stages, you would expect the outcomes might be quite different than if the FGC was offered on the edge of care. So that's why we're doing this evaluation. And here are research questions. So we want to know how widely FGCs are on offer in the UK and what they're used for. We also want to know if families and practitioners, what they think affects how successful FGCs are. We're also interested in how the quality of FGCs and the variation in how they are used affects families' experience, and also what happens to the family over the next 6 months. And then finally, we're interested in longer term outcomes. So what happens to families over the next 2 years who've had an FGC, and we're comparing them to families who have not taken part in FGCs, and also what's the cost, both in terms of the family, but also to the FGC service, and more broader cost outcomes. So we're doing a cost effectiveness analysis as well. To do this, to answer these questions, we're conducting a 4-year multi-method evaluation. We're currently about halfway through. So we've done work package 1, and that's what I'm here to talk to you mainly about today. So that was a survey of FGC services in the UK, and also we co-designed an evaluation questionnaire with families and practitioners. We're currently undertaking work package 2. So that's an evaluation of FGC processes and outcomes using the questionnaire that we co-designed in work package 1. And then the final work package uses administrative data. So that's data collected already by services to compare health and social care outcomes over 2 years using a natural experiment. So I'm going to now talk about the results of the survey that we did of FGC services. So it was a UK-wide online survey, and it was developed in collaboration with Cathy and Sean at the Family Rights Group, and also in consultation with some FGC service managers. We sent it out to all heads of services in England, Wales, Scotland, and to all health and social care trusts in Northern Ireland in May 2022. We also sent it to individual FGC services, which we identified via a systematic internet search. So the reason for doing this survey is that we wanted to map the coverage of FGC services in the UK and to identify how practice may vary between authorities, and also to look at what contextual factors may cause such variation. So we had quite a good response rate. We had responses from 160 individuals from 66% of local authorities in the UK. So that was good. Wales had the highest response rate of 86%, followed by Northern Ireland, Scotland, and England. So as mentioned, we wanted to understand how many local authorities are using FGCs. And as our response rate was 66%, to get a fuller picture of coverage, we supplemented the survey responses with data from systematic internet searches. So we looked for evidence of active websites for FGC services. And then we also checked these findings with FGC network leads in each country, and they also gave us more information about local authorities that they knew were or weren't offering FGCs. And if you look at the map here, those in blue are areas which offer FGCs, and those in white are areas that don't, or that we don't have any information about. Due to our ethical approval, we said that we wouldn't identify areas that don't offer FGCs. So that's why that group is lumped together. We found with these three types of data that 79% of local authorities in the UK have an FGC service. 86% of areas in Wales did, 82% in England, in Northern Ireland 80%, and in Scotland 59%. So as well as coverage, we wanted to know the extent of FGCs being offered in each local authority. So we asked respondents on average how many FGCs do they hold each year. And on average, local authorities held 92 FGCs each year, but this did vary quite considerably. But we also wanted to know not only the number, but how that related to the number of children in their area as well. Because some local authorities might have a much larger population than others, and just so looking at raw numbers doesn't really give you the full picture. So we calculated the annual rate of FGCs per 10,000 child population as well. And the median annual rate was 16 FGCs per 10,000 children. Wales had the highest rate of FGCs per child population. England and Scotland had similar rates, and Northern Ireland had the lowest rate. So we found that FGCs are becoming more common. So we asked respondents when their FGC was introduced. And as you can see from the graph, from about 2016 to 17, more local authorities started to introduce FGCs. And this was backed up by a further question which asked if their FGC service had either expanded in size, reduced in size, or stayed the same. And nearly 2/3 said that it had expanded in size in the last 3 years. So we also wanted to know which sector provided the services, and also how FGCs are funded and delivered. So overall in the UK, most FGCs are provided by the local authority, but we did find variation between the nations. So in Wales and Scotland, for example, there were much higher percentages of FGCs being provided by not-for-profit organisations. And this was also reflected in how they were funded and delivered. So overall, 73% of FGCs were funded in-house by local authorities. But again, there were differences between nations. So in Wales and Scotland, they had high proportions of FGCs contracted, and also in Wales and Northern Ireland, they also spot purchased a lot of their FGCs. The percentages here don't add up to 100% because some areas they fund FGCs in multiple ways. So some of them might be in-house, and then they also might have some that are contracted. So that's why they don't add up to 100. So we wanted to know the stage of concern that FGCs are offered, and you won't be surprised to hear that most were likely to be offered at either pre-proceedings or when a child is considered for a child protection plan. So they both 95.9% of FGCs offer them at those stages. But 71% of FGCs also offer early help services. And we did think that this was it was higher than we expected, and it could be due to various reasons, perhaps varying definitions of what constitutes early help, but also due to the way that the question was worded. We don't know the volume of this FGC provision. So just because in theory a local authority offers early help services via FGCs, we don't know how many they actually offer. So that is kind of an unanswered question, which would be interesting to find out. We also wanted to know which circumstances FGCs are offered. So they're offered for a wide variety of circumstances, as you can see from this graph. but nearly all of them offered FGCs for child abuse or neglect cases and domestic abuse. When we were designing this questionnaire, we found out that some local authorities have a written policy that all children and families should be offered an FGC prior to coming into care. So we wanted to find out, what the situation was across the UK. So we asked local authorities if they had a written policy, and 42% said they didn't, 29% said they did, and 29% said that they were not sure. Respondents in Wales were the most likely to report having a written policy, and Scotland the least. So when we did this survey, it was May 2022. So we just kind of come out of the worst of the COVID pandemic. So we wanted to know how COVID had affected FGC delivery. So we asked a few questions about this, and we found that most services continued to run online during the pandemic, and nearly 2/3 also held in-person meetings. A large majority ran a hybrid service, so 62%. And FGC coordinators said that they experienced difficulties with family access to and the use of technology. They also struggled to make personal connections online, and they found gathering the views of children difficult as well during the pandemic. But they also said that these issues became easier to manage over time, as both staff and families became used to the new ways of working. Most services said that they planned to continue to offer a hybrid model of FGC delivery post-pandemic. So 76% said that. It'd be interesting to see what the situation is now, about a year and a half later. In terms of the conclusions of the survey, so the survey obviously only provided a snapshot of FGC use. And it was limited by what busy service managers had time to complete, given how busy they are. So inevitably, the coverage is limited by response rate. But we have found that FGCs appear to have become more common over time. The rate of FGC provision per head of child population is very variable. We also found that nearly 1/3 of respondents did not know if their local authority had a written policy that all families should be offered an FGC prior to a child coming into care. Over 70% of FGC services appear to offer early help services, which, like I mentioned, seems surprisingly high, given that the government policy and funding has tended to focus on late intervention. And it was also interesting to note that most services planned at the time to continue to offer a hybrid model of FGC delivery post-pandemic. So that's the survey, and I also just wanted to tell you a little bit more about the next steps and what we're doing now. So as I mentioned at the start, we are currently in the middle of Work Package 2, and we're calling this the Family Views and Context Study. So this is a free evaluation of FGC process and outcomes. It's a questionnaire-based study, so we're hoping that we'll have at least 200 family members take part. It's an online questionnaire, but we do have option of a phone call if online is difficult, and there are 4 different versions of this survey. So we've got an adult family network survey, we've got an adult phone call version, we've got a survey for young people aged 13 to 18, and we've got a child survey for children aged 8 to 12. We've also got a questionnaire for coordinators, and we're hoping to do some telephone or video interviews with a subsample of the families, just to understand in a bit more depth about their experiences of their FGC and what's happened since. So in terms of what the family and child questionnaires will cover, we're asking them information about their FGC meeting. So did they feel comfortable in the venue? The cost of the FGC to the family, how they were prepared for the FGC, how they found the meeting, what's happened since in terms of communication, relationship, support, child placement, well-being, and also how satisfied they were with the FGC. This survey is going to be asked at 3 time points. So in the lead up to the FGC, up to 2 weeks after, and also 6 months after. And we're also doing a coordinator questionnaire, like I said, and the reason we're doing this is to add context, but also to reduce the number of questions asked to families. Because when we were co-designing the questionnaires, it was there was so many questions that we could ask and so many questions that people wanted us to ask. So it was quite hard to keep the survey manageable for families. So the coordinator questionnaire is just asked once per FGC, and it covers things like who attended the meeting, the family circumstances, the reason for the FGC, how they prepared the family for the FGC meeting, the resources needed for the meeting, what's happened since, the local authority context, and also we ask about FGC coordinator training. So in terms of where we're at with this second part of the study, so we've got 18 local authorities that have signed up across the UK, which is great. It's great that we've had so much interest and everybody that all the kind of coordinators and FGC managers that are taking part are really enthusiastic. So that's brilliant. We're currently collecting the baseline data. So we started that in November and that will finish in May. And then we'll finish data collection in November. So that'll be 6 months from the last baseline data. And then we'll hopefully have some results to share with you in summer 2025. So that'd be really exciting. So that's all from me. Thank you for listening. If anyone wants to get in touch to ask anything via email, that's my email address. Obviously I can answer questions as well at the end of these presentations, and I'll also put the link to the report of the survey that I was presenting in the chat, so you can have a further look at the findings. Thank you.
Thank you, Sophie. That was fantastic. And please, if anyone's got any questions for Sophie, just put them in the chat and we shall pick them up at the end. There's been a few comments and questions as we've gone along. So we're now going to move on to Jo Flanagan. Jo, have you got your slides to share? And just start when you feel ready.
Yep. Can you see those?
We can.
Great, thank you. Well, it's lovely to meet you all today and thank you for joining the session. My name's Jo Flanagan and I'm a Senior Local Development Advisor at Foundations. In this session, I'll walk you through the journey that we've been on to try and understand and maximise access to the family group conferencing intervention. So in the session, I'm going to tell you a little bit about the recent randomised control trial that we did about family group conferencing, and then the sort of subsequent scoping work that we did in the summer of 2023 to try and understand a little bit more about what was happening in local areas and the findings from that. And then I'll talk you through our next steps and plans for the future with regards to FGC. So first of all, just a little bit of information about Foundation. So we're the new What Works Centre for Children and Families, formed in December 2022 by the merger of the Early Intervention Foundation and the What Works Centre for Children Social Care. We're a research into practice organisation established by but independent of the central government. The new organisation reflects the best of the previous two charities. We draw on the rigorous trial methods of the What Works Centre for Children's Social Care and the experience from the EIF of evidence synthesis and supporting local area leaders to use evidence. We retain a focus on providing support at the earliest possible stages with a particular focus on the family context. And when I say family, I mean family in all its forms. So family can be one of the most powerful conduits of almost every outcome that children experience. And these relationships are so fundamental to children's life chances and can be improved by high quality support, yet this is not always provided when needed. We don't always do enough to support family relationships, so what we hope to do with the new organisation is to focus in more on this as time goes on. So next slide. So a little bit of information about the family group conferencing randomised control trial. So why did we do it? Well, the aims of the study were to understand the effect of referring families for a family group conference on the likelihood of children entering care, as well as other outcomes for children and families entering at the pre-proceedings. We also wanted to understand how family group conferences were delivered, for example, identifying the barriers and enablers to successful implementation. And we wanted to determine the cost benefits of implementing family group conferences for local authorities. So how did we go about doing that? So we conducted a large-scale randomised control trial across 21 local authorities in conjunction with another organisation called Coram. Information was gathered from local authorities about whether children in the study became looked after, their living arrangements, and whether care proceedings were issued. And then there was an analysis which compared the findings between families referred for family group conferences and those not, so those that just received business as usual support. And then we conducted an implementation and process evaluation to look at how family group conferences were implemented and perceived. So what were the findings? Well, what we found was that children were less likely to be in care 1 year later compared to those that hadn't been referred. And we also saw that children spent significantly less time in care 6 months after the FGC compared to those who weren't referred. And they were less likely to have had care proceedings being issued compared to those who hadn't been referred to FGC. And over 3/4 of the local authorities thought that family group conferences at the pre-proceeding stage had made a difference to how they worked with families. And they also found that it was cost effective, with a saving of £960 per child referred in the first year. What we also found qualitatively was that there was something about the quality of delivery that was really important, and the local authorities really needed to adhere to the family rights group standards that Cathy talked to you about earlier. And that a range of other interventions are often required to be offered alongside the family group conference to meet the needs of children and families. So, for example, often there might be some family mediation going on at the same time. And we also found that we felt there needed to be a lot more research into the effectiveness of family group conferencing at other points in the system. So I think Sophie's talked to you a little bit about this, about the different points that children are offered at family group conferencing. And we are aware that local authorities use it at many different points. It's particularly popular at the early help stage. So during the summer of 2023, we decided to dig a little bit deeper to find out what was happening on the ground in local authorities. And there was a rationale behind that. So we, based on the trial, we'd estimated that if family group conferences were to be rolled out across England, 2,293 fewer children would go into care in a 12-month period, which would save the public purse over £150 million over 2 years. And we knew from the Cascade Family Voice Survey that around 80% of local authorities in England report delivering an FGC, with the majority of these services being run in-house by the local authority itself, and most respondents reporting offering FGCs at the pre-proceeding stage in England. We also understood that there were high levels of variation in how FGCs are delivered across the country. And also our trial found a positive impact for family group conferencing use. However, the wider evidence base is quite inconclusive. So we were quite keen to understand a lot more about how FGCs were used on the ground, as well as keep abreast with latest research and understand where the gaps were in the evidence base. So what did we do? We had conversations with 15 local authorities about their FGC services to understand their barriers and enablers to use, as well as to understand the groups where it works well and not so well. We also looked at how they monitored and recorded outcomes for children and families. We also had some chats with some of the independent providers that were providing family group conferencing. So these tended to be BCS organisations who were commissioned by local authorities to provide an independent service. And they tended to provide lower numbers of family group conferences in comparison to the in-house providers in local authorities. We also had to talk to some of the key stakeholders in the world of FGC. So we had a chat with Cascade, the Family Rights Group, Daybreak, another provider, and the ADCS to understand the scope and scale of FGC use across the country. We completed a systematic review which looked at the UK and international studies of FGC use, including those from minority ethnic groups. And we looked at which LAs were using FGC at the pre-proceeding stage, how many were completed per year, and whether the service was provided in-house or by an independent provider. So what we found was there was broadly an issue, positively or negatively, about access. So I'll just talk you through some of the findings that we sort of that came through in terms of the themes from the work over the summer. So in terms of capability, there were some barriers around capability. Local authorities described the resource constraints that prevent them from expanding their family group conferencing offer. Many pointed to budget pressures and cuts and the costs of providing services, with a broad consensus that it was cheaper to offer an in-house service than to commission a provider. Some local authorities were proactively engaging with the context by producing a business case, making value for money arguments about their service with senior leaders in their local authorities. And we did notice that many of the local authorities found it quite difficult to describe the cost and value of their service beyond sort of anecdotal information. Despite general consensus about their importance, there was large variation in the skills, professional backgrounds and pay of coordinators. There was a variety of training available to coordinators, both from FRG here today, Daybreak, and when we spoke to some of the London local authorities, they also have a network of training for local authorities in their own region. Some local authorities described employing coordinators with professional backgrounds such as ex-social workers or therapists, whereas others drew from a wider pool that included members of the community. The skill level of the family group conference coordinators was also identified as a key capability that was central to the impact of family group conferences. Private providers and local authority areas describe the importance of key skills and values of coordinators, including how to communicate with families, addressing any issues as part of the prep work, for example, through having restorative conversations, and understanding local community needs. And then in terms of the opportunity barriers, we found that more work is needed to understand for whom family group conferencing works and to ensure access is equitable. So in our trial, 78% of the sample were white British, and the study found a borderline significant effect for ethnicity in favour of family group conferences benefiting white British families over other families. Despite this finding from our trial, our summer systematic review included 8 qualitative studies of racially disadvantaged families in England, and it indicated that these families found FGC to be empowering and had cultural applicability, meeting cultural needs, for example, shaping the framing of FGC language around their own culture. Practitioners appear to view family group conferencing as working better for some family situations than others. So services reported that in their experience, FGC worked best for families with an at-risk unborn child, families who are perhaps resistant to working with social workers where there's an independent coordinator. It seemed to work well for parents with substance misuse, domestic abuse, and where parents have mental health challenges. However, practitioners feel it works less well where there are private care proceedings or where cases have been going on for many years, or where social work have been involved with families for generations. It also appears to work less well with older children whose parents say they cannot live with their child or young person anymore, or when there is an emergency or urgent need to address the safety of the child. So we wonder whether these perceptions could be a factor which might be shaping why there might be differences in the referral rates in local authorities, because it might be dependent on the type of the case that's being discussed and the family that the social worker is working with, that might also explain some of the variability. During our scoping exercise, the systematic reviews we identified found mixed results or no impact compared to business as usual across the areas of maltreatment, reunification, engagement with support services, and improving child mental health. So there are opportunity barriers to access to family group conference, even when a service is available, when it's not routinely embedded into local authority structures. So some local authorities described that they had a really sort of whole system approach to the use of family group conferencing, where the principles such as restorative practice were embedded in delivery right from the front door through to reunification. However, several areas described a service that was not routinely embedded into the wider work of children's services, and this meant that opportunities for referral weren't always routine and often required the FGC service to work alongside social work teams to encourage them to offer the service with families, to encourage them to refer families in for FGCs. And that was also supported by our implementation and process evaluation, which found a reported disconnect between children's social care, which meant referrals weren't necessarily always coming in. It appears that not all families are being offered the opportunity for a family group conference, and we heard from providers and services that their referral rates can differ between different social work teams and between different individuals. Their assessment was not that the buy-in of individuals was about the buy-in of individual social workers, and it was central to driving referrals. So they reported if social workers weren't necessarily bought into family group conferencing, or that it was going to be an independent service, sometimes that might affect how the social workers would refer in and offer a family group conference at the pre-proceeding stage. So in terms of motivation barriers, not all families accept the offer of a family group conference. In our trial, about 50% of the families offered an FGC accepted, and there was variation in this conversion rate. So when we had a conversation with the 15 local authorities, there were variations there as well, from one local authority saying they had about a 72% conversion rate, and another achieving 24%. So not all local authorities we spoke to were confident in the proportion of families that took up an offer of the FGC, and some were able to evidence this. And then the role of the referrer appears to be key in securing access for families. Our IPE describes staff turnover, a lack of engagement from social workers, and time and capacity constraints as a barrier to referrals. This was echoed in the stakeholder conversations that we had over the summer, where there was a lack of consistency in terms of social workers, how they made and it was about how they built relationships to be able to refer families in. And then local areas described the importance of the role of senior leaders in giving a profile and resources to family group conferencing. So in our IPE, an independent provider reported the importance of having the buy-in of senior management and the impact that this can have. And this was echoed again similarly in our stakeholder conversations, where it was felt that senior buy-in increases the profile of family group conferencing in a local authority. So what are the next steps for us at Foundations with respect to FGC following our randomised control trial and the scoping work that we did over the summer? So we know there are barriers across the system that need to be addressed if we want more families to be meaningfully offered the opportunity of an FGC at the pre-proceeding stage. And we need new work on monitoring to be able to measure the success of this. We want to take an active role in championing FGCs, and our work will focus on 4 key areas. So the first will be where we'll have a continuing relationship with the government to make the case for investment in FGCs at the pre-proceeding stage. We're going to be doing some work directly with local authority managers and leaders to make the case for investment in FGC services locally. We have some new work that's about to start to understand data and monitoring in local areas with a view to improving the routine data collection in local areas so we can understand the ongoing impact of FGCs on outcomes. And then after April, we'll be starting a new qualitative piece of research with families to understand their experience of being offered and receiving an FGC, with a particular focus on the experience of minoritized ethnic families. So that's it from me, and look forward to hearing your questions.
Brilliant. Thank you, Jo. Do you want to just stop slide sharing and then we'll bring us all back to the main group? So we've got a number of questions in the chat, which we'll go through. Also, is there anyone brave enough in the room? I know there's a lot of us here. Feel free to put your hands up as well if you'd rather speak rather than write something. But to start with, just moving through the questions. Jonathan Shepherd, you asked, are family group conferences based on the same principle as restorative justice conferences, which also have their origin in Maori culture? I think, Cathy, you've said yes, they are. Is that right? Yeah, Cathy's nodding. Don't know if you...
Yeah. So, I mean, and in New Zealand, they are used both in terms of youth justice as well as in terms of child welfare decision making, and it is the primary mechanism by which plans are made for children. So a child would not be in the care system in New Zealand without there having been an FGC. And interestingly, if you look at the numbers of children in care in New Zealand, significantly lower per 10,000 children than in countries of the UK. And not only is it significantly lower, but there's also a much higher proportion of children in kinship care within the care population in New Zealand than there are in the UK. So you've got fewer children in care, and of those, they're much more likely to be living with wider family and friends in the UK. But the answer is that, as I say, in New Zealand, much more so than here, it's used both in youth justice and child welfare.
Really interesting. Thank you, Cathy. And then we've got another one, I think, again for you, Cathy, from Polly Green, saying, I've heard that court requests an FGC and family are told they have to have one. So this is about courts. What should FGC coordinators do in these circumstances? Penny Banbury's followed that up by saying, yes, we have regular requests from court. And I've certainly heard that as well. So, Cathy, do you want to come in on that one?
Yeah, so some of my colleagues are legal advisor and FGC practice leaders, been doing a series of online workshops for the judiciary and magistrates and perhaps in different parts of the country, in part to try and educate them about FGCs and what can be asked and what can't be asked. So I would say it's important that your senior managers at your local family justice councils, you try and educate the judiciary about the what is an FGC, and critically that it's not something that families should be compelled to do. So I think where the judiciary, where a judge has said you must, I think you can take that as you must offer the family an FGC, but I think it's reasonable as long as, you know, based on families making informed decision making, it's reasonable. If the family is very clear that they do not consent to an FGC, then that needs to be relayed.
Thanks, Cathy. That makes sense. And then Polly has come back in, talking about COVID years. I know you covered this, Cathy, in your presentation, as did Sophie. And just a comment, really, that in Polly's area, they are back doing them almost all in person now. And you've responded by saying that certainly in person is what you would recommend at Family Rights Group.
Can I just add to that, because it's not, you know, we've seen it whether it's FGCs, whether it's child protection conferences, that you need to be really careful that organisation expedience and resources don't drive how families experience the process. And so, yes, there's times where we all know it's, you know, people may prefer something by WhatsApp or prefer by etc. But critically, the starting position should be that it's in person and that coordinators are going out and meeting families as part of the preparation. And I think it, you know, you lose potentially a lot if you try and sort of skip that.
Thanks for that clarification, Cathy. The next question is from Hannah Vins. I hope I'm saying that correct, Hannah. Tell me if I'm not. It's really a question for Sophie, I think. So are there any caveats to the survey, given that the sample size was quite small, i.e. can the results be used as evidence in FGC policy?
I think with any survey, particularly as it's self-report, there always should be caveats. But I think that although there's two things really. So the response, there was 160 people that completed the survey, but we asked only for one person per area to fill it in. So when you look at it that way, 66% of areas in the UK filled it in, which actually is quite good. Particularly in areas like Wales, where 86% of people, 86% of areas completed the survey, and in Scotland, I think it was 80%. So yeah, I do think that it could be used in policy. We've had an example from Camden, actually. They found the report really helpful, and what they did was they took it to their one of their boards. I can't remember the name of the board now, but they kind of showed the national picture next to what they do in their authority, and they found that really helpful. I also think the question about whether local authorities have a written policy, whether children and families should be offered an FGC before coming into care, was also really helpful, and I think could inform policy in that area as well.
Thank you, Sophie. We've got a question from Sandra Beaton that actually could be for any one of our presenters, so whoever feels best placed to answer this. So variability of the FGC offer, what are the chances of making FGC a statutory universal offer, as in New Zealand? Does anyone want to have a go at that one?
I'll happily go in for that one, because it's our... we have been pushing this as an organisation. So you'll see that almost every on our website, if you look under campaigns and legal reform, you'll see it as a recommendation in virtually every briefing that we do. Well, on a positive, the government's kinship strategy does talk about this as a sort of long-term consideration pre-proceedings, so making it legal right, and that obviously follows from the Independent Children's Social Care Review. So it's starting to sort of it's starting to be considered, I think, at a serious level by politicians. I also think that the research that Jo and her colleagues led has persuaded some in the Treasury that actually maybe FGCs are a good thing after all, in a way that they may not have previously been convinced by because of the cost impact. So there is an opening there. But I think what I would say is it requires a concerted effort by all, including everyone on this call, to be pushing it and to be lobbying their MPs or parliamentary candidates, and for it to be seen, importantly, as some of the answers. It's not the entirety of the answer by any means, but some of the answer to how we address a child welfare system that's not working adequately for children, for families, or for the public purse, and family-led decision-making, supporting families to have the resources to take responsibility for children within their family and community, I think is a critical part of how the system needs to go forward.
Thank you, Cathy. And just after that, we've got a comment from Jonathan about just recognising from what you've said earlier that participation of the wider community is a characteristic of family group conferencing, as it is with restorative justice conferences. And then a question at the end of that: did FGCs, are they a product of? Did they come out of the restorative justice practice? Do you know?
They didn't come out of restorative justice practice, but the principles are consistent with and go in tandem, I would say.
Thanks, Cathy.
Thank you, Cathy.
Thanks, Jonathan. So this is a question for Jo, one from Hannah at DFE. Did the RCT format take advantage of families who had refused FGCs voluntarily, or did it deliberately not deliver FGCs to a control group?
Well, I just need to double check that question. I did see it in the chat because I wasn't at Foundations when this study was carried out, but I understand that families were allocated to the control and the treatment group. I think they might have been offered it afterwards. Is that right, Cathy?
So it was one of our concerns. So I know about in terms of methodology. So basically, they were divided up into the treatment and the control group, as you say. So those who were not offered an FGC didn't even know they weren't offered an FGC because it wasn't something that they were aware could be offered, unless they happened to have a lawyer who was clued up, etc. So yeah, it wasn't based on those who by informed consent refused the FGC. It was based on some families weren't offered it and some were, in order to get that matching that's sort of sought after in the RCT.
Thank you for clarifying, Cathy. I'm going to bring Amy Kears in now as our first put-in hand up before we move on to the rest of the questions in the chat. Come on in, Amy.
Hi, I just wanted to ask, because I really believe in the ethos of the family group conferences and have witnessed firsthand how they can really be meaningful change for the child. But I can't see anywhere, because the county that I work in, they no longer provide these meetings, and I wondered, is there a cost kind of in any of the research? I know it's probably really, really difficult because every one is individually takes different amount of time, and different family members and visiting them and preparing them and all of that. But I wondered, is there a general kind of cost or even like how many employees you would need to provide a local authority for with family group conferencing? Is there any kind of research around that, really? Because it is cost saving, but
yeah, so
what the cost is as well.
Yeah, sure. So that's kind of what our next work package is going to look at as well. So the survey for the coordinators will ask how many staff were needed, how much time. Also, we're asking things about salary bands so we can try and find more of an accurate measure of how much an FGC costs. Obviously, like you said, it's going to vary, but hopefully we can kind of make a bit of an average. And then also we're asking how much it costs the families to attend as well, in terms of maybe time that they're taking off from work or travel, whether they're reimbursed for that travel. And then as part of the our work package 3, so the last work package where we're looking at longer term outcomes, we're looking at service use more widely, so like health service use and things like that. So we will also look at kind of wider costs of service use for families that have an FGC compared to those that don't. So we're kind of we're trying to look at that from 3 different angles, but we don't have that data yet. So yeah, but it will be coming.
That's
Thanks,
also
Sophie.
a piece of work that we're doing as well. So we're currently having conversations with directors of children's services, ADs and elected members to understand how they make the case in their own local area for an FGC service, how they put together a business case, what are the key factors that they put forward to suggest that the service is needed and to maintain it as well, which is the key thing, which everybody seems to be talking to us about at the moment in the light of the current cuts. That they want the FGC service to be protected and valued and not to be eroded. So we're very keen to understand how that case is being made to decision makers in local authorities, so that we can put together a publication for local areas that they can also share and use if they also want to be able to do the same.
Thanks, Jo. And I think the next, before I move on to the next question, just a comment. Sandra Beaton has said a statutory offer would enable rigorous benchmarking and hence adherence to good practice. And then I think this one's for you, Jo, from Claire Barton. So about the key findings on who was it who identified that it doesn't work as well with older children? Was it family practitioners or referrers? Do we know that from the research?
It was conversations with family group coordinators in the 15 local authorities this summer, and it was in particular relation, not sort of generally older children, but older children whose parents say they cannot live with their child or young person anymore. So it was quite a niche thing. It wasn't a sort of generic thing. It was quite a niche issue. But it was 1 or 2 local authorities mentioned that scenario where they find it doesn't necessarily work so well. But I don't know, Clara, your experience is different to that.
Yeah, sorry. I guess it was a wider point I was thinking about really as well, because I think, I've been running a large service for a long time now. And we do over sort of 800 meetings a year over in Kent. But what I do find is that those are some of the most difficult meetings to hold. So I don't necessarily agree that the results aren't as good, because we have fantastic results when we can manage to get those people in a room together. I think they are harder sometimes because there's a lot of conflict going on. And I guess it's a wider point about the skills of the coordinator, and how important their role is and how much training they need, how much support they need, and about local authorities really thinking about that this is not an easy job to do when you're dealing with that level of conflict and involvement with the local authority. So I just wanted to make a point about, I know you said you were looking at bands of payment and things like that, and that being different, that, we really need to support those coordinators who are out there doing that work too.
Thank you, Claire. We've got a couple of questions, one from Denise Winter and one from Maria, that are related. So I'll read them both out, and then perhaps one of you can provide some answers. So Denise has asked, is there still a concern about inclusion as the numbers of Black and global majority families in your key findings involved with family group conferencing? And Maria has asked, Are there any examples of good practice where areas have positively engaged with minoritised groups and seen a take-up of family group conferences, and what has enabled this? I don't know if anyone wants to step forward and take those two questions.
Can I just, so a number of years ago, we led, Family Rights Group led a action research study with two Black minority ethnic community organisations locally, looking at how if FGC services were either run by or heavily engaged, run by those community organisations, or those community organisations were very heavily engaged in encouraging referrals, encouraging support, the difference that could make. And in both cases, there's a report and recommendations, but in both cases, unsurprisingly, it did make a difference. What I would say is that since then, the deficit has been primarily the lack of effective recording of which families are being offered FGCs, and that's true in relation to identifying whether different minority ethnic communities are being offered FGCs or not, and actually that's also true in relation to disabilities. So there is a real question about what data is kept in order to be able to understand properly, actually, are certain groups more likely to be, it's not just about whether they participate in the FGC, it's also, are they being referred for an FGC, who's making the referral, how is that being done, how are FGCs being effectively sold to the family, as well as questions around, for example, cultural matching, what support services are available, etc. However, and just there are some really interesting international studies that, including one in Australia that's due to be published, which is very focused around Indigenous populations in Australia, and how actually what they found is that basically FGCs, when focused on those communities' needs, are more effective than statutory options, and that's not a great surprise, really. So I think there's a lack of research in the area, there's a lack of data being collected, but there is nothing which says that families from specific minority ethnic groups are less likely to engage with FGCs. And I think given its origins, it would make sense that actually the opposite was the case.
Thank you, Cathy. We've just got a few minutes left, so we've got a couple more questions in the chat, and if anyone's got any questions they want to raise their hand for, we might have got time for that as well. So we've got a question from Ian Hemmings. What are the key features of an effective review process? And then another question from Sandra Beaton. Is the difference between family group conferencing and non-family group conferencing the extent to which professionals run the cases? I'm assuming that means, Sandra, and correct me if I've got this wrong, is it about the quality of the individual worker and how they engage with the family and introduce family group conferencing? Is that a critical feature as to the success or not? But come back to me if I've not got that quite right. The first one, in terms of review process, what are the key features of an effective review process? Sophie, shall I come to you? Have you got any ideas on that one?
I feel like I'm probably not best placed to answer that. Maybe Cathy would be.
Cathy, come on in.
I feel a bit like an answer hogger. I want to put my so actually, it's the exact same features that I've spoken about in relation to the FGC itself. So it's got to be voluntary, it's got to be respectful of the family member's time. It depends where it's held. I mean, I can see Claire Barton on the call, and I know she's just spoken, and she, I'm sure, can wax lyrical about how to make that process as effective as it can be. But really, you're going back to the question, is this plan meeting the concerns that both social workers, others, and the family may have, and does something need to be adjusted? Does it need to be fully reviewed, or are there support services that aren't being, or it's all the things that you would expect. And secondly, I would say in relation to the key features, I mean, I hope I went through those at the beginning, but principally, this is a family-led decision-making approach. Now, embedded within it is the safety of the child, and that's, obviously that's why we all do our jobs in relation to the welfare of children. But the critical difference between that and, for example, your child protection conference or your public or outline pre-proceedings conference, is that this is family-led, and that's family however that family defines it. That's the key difference.
Thank you, Cathy. And I think that broadly also covers Sandra's question about the individual worker and the input and the importance of them and their approach. There's just it's a quick one, Jonathan. You've got the final question to ask, so go ahead.
Yeah, thank you, Gail. I think it's a quick one. I wondered if Foundations is publishing guidance on this. The evidence seems to be pretty full, although not complete. I don't know if Foundations has a toolkit like the Youth Endowment Fund has, but if so, will this be going into the toolkit, the Foundations toolkit? Thank you.
Thanks, Jonathan. We're in the very early stages of this. I think that's what will become of these next steps of work. So we'll be developing a publication to support local authorities to make the case for family group conferencing in their local area. So that should be out in the late spring, I'm hoping. And then there'll be the publication of our findings from the qualitative work with families that will be available next March, April time as well. So it's an emerging piece of work, and we hope to keep building on it so that yes, we would have a wider suite of information that we could make available as time goes by.
Yeah, so no formal guidance or in the toolkit yet?
Not as such. It's early days.
Thank you very much.
Thank you. And that brings us bang on to 3:30. Thank you very much to our three speakers, Cathy, Sophie and Jo. Thank you very much to everybody who's attended today and for your contributions. Really, really appreciate it. Do keep coming to these virtual learning cafes and also feeding back about how you found today. And we are very keen on feedback, and we tweak things as we go ahead to make sure that we're meeting your needs. So have a good rest of afternoon. Thank you, everybody. Bye.
Thank you.
Thank you.